Welcome, everyone. Thank you for coming. And my name is Anne Marie Schieber. I'm the managing editor of Healthcare News, and very pleased to be introducing our panel discussion here today, Liberating the Healthcare Marketplace. I imagine a lot of you have gravitated into this room because you are frustrated, probably just downright fed up with our healthcare system, how we could be blessed in a country with prosperity and freedom. I mean, I don't know if you got a chance to go to the Mount Rushmore exhibit. It just gives you chills because people so deeply cherish our freedoms. And we have a healthcare industry, a huge chunk of our economy that has been hijacked by regulators and middlemen and cronyism, and major problems in access. I mean, it eats up a huge chunk of our economy, nearly 18% of GNP, and we turn around and we had one of the worst performances of dealing with a public health crisis. I just checked it this morning, the 21st worst country out of 200 in the world for coronavirus deaths. We hit another record of opioid overdose deaths last year. And we have problems with untreated mental illness on our streets with homeless people. We have people who can't afford, who are underinsured or overinsured. The problems, we have difficulty getting drugs to market in a timely fashion, in an inexpensive way. The list goes on and on and on. But I hope you do not leave here, I hope you leave here with a sense of optimism, because there are a lot of common sense solutions to many of these problems, and that's what we're going to be talking about here today. Before I tell you more about our distinguished mini panel, I want to make a pitch for this publication, Healthcare News. I am honored to be the managing editor of this. It's co-published by the Heartland Institute and John Goodman here, who actually is a really terrific savior, really, of the paper. Last year when all this pandemic pandemonium was unfolding and we were facing a bitter election, John went out and was able to secure support to keep the paper up and running for the next year, a very critical year. And I know I'm very grateful for that, and our readers are grateful for that. And we would invite you, we would love if you if you'd like to subscribe to it. It's a great deal. It's free. We'll send it to you. What it is a newspaper-type publication, probably, I think, the only printed newspaper that presents healthcare policy from a free market perspective. We take actual news articles, we write these as news articles, and we make it very clear when we're editorializing, when we're offering viewpoints. Unlike the mainstream media, we do not pretend to be balanced. We are not balanced. We present this from a free market point of view. And we send it to Republicans and Democrats alike, over 8,000 people, even thought leaders, to give them talking points, to educate them about healthcare policy. And I know that it lingers in their offices. We send it to them whether they want it or not. If I were a Democrat, I wouldn't want to throw it away. I'd want to know what the other side is saying. So we hope that other people pick this up and get some of these ideas and start putting them into place. And to make it even more enticing for you to sign up for this publication, you could stop by at the Heartland booth, number 704. And I'm giving away tonight, if you want a free ticket to go visit Mount Rushmore under the lights. It's really, it gives you goosebumps. It's really remarkable to see. So I have a free trip. We're going to have a little raffle. John is going to be signing his book at the booth afterwards. We'll talk a little bit more about that. But fill this out, put it in the box. We'll do a drawing, I think maybe at 5 o'clock. And you get a free ticket if you're interested in doing that. All right, now on to our panelists. First is Marie Fishpaw. She is the Director of Domestic Policy Studies at the Heritage Foundation. No doubt a very demanding job. She brings with her some big policy chops to that position, serving as the Deputy Assistant to Vice President Dick Cheney in the White House. And she was a senior member of the U.S. House Committee on Energy and Commerce. And on the business side, she helped build up Bloomberg Government, which provides news and analytics services. And then John Goodman, who is known as the father of the HSA, the Health Savings Account. He is the author of multiple books, including the latest, New Way to Care. And when you leave here, you can get a goodie bag and get a copy of this book. It's chock full of information I read it and keep it on my desk as reference. As you can see, there's a great index, lots of reference information, and common sense. He talks all about the common sense solutions about how government has now become our biggest underwriter of risk in our lives and why that's not a good idea. John was he's also the president and founder of the Goodman Institute of Public Policy, also the co-publisher, as I said, of Healthcare News. Before that, he was with the very influential National Center for Policy Analysis. He is a fellow at the Independent Institute. John recently, as we talked about, not just this book, but a number of books, and they're also at the booth for you to look at. One of the things I read about, interestingly enough, is, at the booth in the last couple of days, a lot of people have come over and shared with me their healthcare experience, many people working in the healthcare industry, and had lots of questions about Medicare, what's going to happen to that. That is really just could be a pending disaster. And some of the things that I learned in this book that were so cool that, if you started out early in your career and you could set aside 4% of your income, think about what we pay in payroll tax, and if you did that, you could have enough to take care of your retirement and health care needs when you're ready to use them. So I am now not going to say anything. I'm going to end it about 15 minutes short to give everybody an opportunity to ask questions. And I think probably the best way to do it is to maybe go up to the mic in the middle, and we'll field your questions. So now over to John. Or you want to use that?
No, I'll use this. Looking at all the bookmarks that she has on my book, it's kind of unnerving. I'm afraid she's going to ask questions about all of that. Well, since it's a conference with sort of a libertarian bent, I want to begin by making 3 observations. And the first is that in the ideal world, there would be a complete separation of medicine and state, just as there is a separation of church and state, and for the same reasons. But number 2, given all that, it's nonetheless true that there's probably no area of your life, none whatsoever, that involves more government regulation than healthcare. So government is very involved, and it didn't start with liberals, and it didn't start with the progressives back at the beginning of the 20th century. The beginning of all this, you have to go all the way back to the middle of the 19th century, and guess who wanted government involved? It was the doctors. And so they had the first meeting of the American Medical Association, and they laid out a political agenda. And first thing they wanted to do is control who could become a doctor, who could practice medicine. And then they wanted to be able to punish doctors that didn't fit in with their view of the world, which basically they made an ethical obligation of doctors to participate in a cartel. If the doctor didn't want to participate, they could remove his license to practice. Then they wanted control of the medical schools, so they controlled how many doctors there would be. And when I say doctors, this is really organized medicine. It may not have represented all doctors, but it was the doctor force in politics. So then they went after the hospitals, then they went after the insurance companies, and I would guess that over a 100-year period, the medical profession was more successful in getting favors from government than any other profession in the whole country. We get up to about middle of 1970s, maybe 1980, and things began to turn around. And the monsters that the doctors created turned on the doctors. And today, you're hard pressed to find a doctor today who tells you he or she enjoys practicing medicine. So now they're the victims. And even though they had nothing to do with what happened 170 years ago, they're the victims today. Now, the third point I want to make is that sometimes libertarians make the mistake of thinking, well, the answer to this is just for the government to get out of everything. But if you go around saying you want to abolish Medicare and abolish Medicaid and abolish Obamacare, it's not going to get you very far. And the reason is that the private sector adjusts to all this regulation, all this government interference, all this bureaucracy. And by the private sector, I mean patients, doctors, employers, insurance companies. They have to adjust all that to survive. And so when you say we're going to take away your Medicare or your Medicaid or your Obamacare, people are left to wonder, well, what does that mean for me? And Republicans for 10 years said they were going to abolish Obamacare, didn't get them anything, and now they don't even say it anymore. So what's the right approach to this? The right approach is to find wedges, and wedges where we can empower individuals and empower markets, liberate markets. And once that begins to happen, then we can find additional wedges. So think of what the left does. The left doesn't walk in, you get socialized medicine most of the time, not in this country. We get Medicare, we get Medicaid, we get Obamacare, so government just gets larger and larger presence in the healthcare system. We need to reverse that. We need to free people and liberate them, and then the liberating movement gets stronger and stronger through time. So you cannot do this all at once. You have to do it piecemeal. Now, the Trump administration was very, very successful in doing what I just said. And most people don't know about it because the mainstream media didn't cover it. And even the healthcare media didn't cover it. But one of the very first things the Trump administration did was deregulate the production of vaccines. Nobody knew we were going to have a COVID. Nobody expected that to happen. But when COVID came, by that point, vaccine production had been deregulated. And because of that, we got our vaccines in this country, I would say at least 6 months earlier than anybody thought was possible. And the economists at the University of Chicago estimate that vaccine production deregulation under Trump probably saved 182,000 lives. So that's a big, big deal. And then what else did the Trump administration do? They brought us telehealth. And they were working on it for 3 years because they believed in it. But at the time we entered the year 2019, it was against the law for seniors to talk by phone with their doctor or by email or by Skype. And when COVID hit, Congress had temporarily suspended the legislation which prohibited telemedicine in Medicare for all practical purposes. And so the Trump administration jumped on it. They were ready. They'd done all the many, many months of background work. If Hillary Clinton had been president, we might eventually have gotten telemedicine, but it would have been 11 or 12 months later. So the Trump administration made it possible for seniors to talk by phone, email, Skype. For people on the younger generation, they could get on their laptop, they could in the privacy of their own home, have a virtual consultation by Zoom or Facebook or some other virtual way. This is huge. Another thing the Trump administration did was, by executive order, no congressional action at all, reversed what the Obama administration had done and allowed employers to buy for their employees personal portable health insurance. This is health insurance paid for by the employer, but the employee owned it and could take it with him in and out of the labor market to the next job. Hugely, hugely important when COVID hit. It's too bad more employers didn't know about it because the newspapers weren't writing about it, the healthcare press wasn't writing about it. But going forward, this is really, really important. So going into this last election, think of all the wonderful things the Trump administration had done, and I've just given you a few of them, to deregulate healthcare. No one ever expected this kind of deregulation. Over on the Democratic side, what did they have? Well, they had Obamacare. And what can we say about Obamacare? Well, in the part of the market where they didn't get subsidies, it was in a death spiral. I mean, just with each passing year, fewer and fewer people were even in the market. And the last year, if you take the average premium and the average deductible and add them together, a family of four had to spend $25,000 before it got any benefits from its health care plan. Now, most people don't even consider that real insurance. So we have outrageous out-of-pocket expenses. We have networks that continue to get narrower and narrower, excluding the best doctors, excluding the best hospitals. In Dallas, Texas, where I live, you cannot buy individual insurance, which gets you into UT Southwestern, which is probably one of the best medical facilities in the whole world. But if you buy Obamacare, you buy individual insurance, you can't get in. In the whole state of Texas, you cannot, with Obamacare insurance, get into MD Anderson Cancer Center down in Houston. And this is happening all over the country. So given what the Democrats gave us and what Trump gave us, healthcare should have been an issue that really worked for Republicans in general and for Trump in particular. But Donald Trump never got on TV and held up the phone and said, you know, I did this for you. And Donald Trump never said to employees, I made it possible for you to have health insurance that you can take with you if you get laid off or you lose your job. I mean, he just didn't campaign on what he had done. And quite frankly, I'm not sure that Donald Trump knew what he had done. And put aside Donald Trump, what's the problem with Republicans in general? Well, this should have been a Republican issue, but when you ask voters, they tell you two things. One, health care is our number one issue. And two, we trust Democrats more than Republicans. So why do they do that? And I think it's because of the Democrats have mastered four rules that are very important in communicating about health. First, they talk about benefits and not how they're going to give you the benefit. And Bernie Sanders is a master at this. He goes out there and says, I want Medicare for all. And when you hear that, what do you think? You think you're going to get pretty good health care and not have to pay very much to get it, right? Bernie Sanders never gets caught in some long discussion of how he would get 160 million people out of their employer plans and over into Medicare. I mean, that must be some major shift, and you won't catch him spending a lot of time talking about it. Now, Republicans are different. They want to tell you how they're going to do things. And so the one time they really had an answer to Obamacare, what was it? It was to send the money back to the states, all right? Block grant. Obamacare funds back to the states, give states control over it. Well, what does that mean for you? Well, you probably have no idea. And voters had no idea. And so because Republicans don't know how to talk about benefits, they're talking about process. And then Democrats always talk about people. Republicans talk about systems. When Democrats talk about health, they're talking about high drug prices. They're talking about pre-existing conditions, which means they're talking about things that affect you as a patient. What do Republicans talk about? Well, Republicans talk about buying health insurance across state lines, association health plans, certificate of need, antitrust, and that's their language. That's what they talk about when they talk about health reform. So how does any of that affect you? Well, if you don't know, I guarantee you most voters don't know, and so Democrats have much better instincts here. Then Democrats always try to focus on people who vote. Now, when Obamacare started, its original aim was to insure the uninsured. That's why the Democrats proposed Obamacare. But then Chuck Schumer learned that people who are uninsured mainly don't vote. People have insurance vote. People who don't have insurance don't vote. So they're about to spend billions of dollars on people who weren't going to vote for them because these people weren't voting for anybody. And so they did a mid-course correction. And you don't hear Democrats talking about insuring the uninsured through Obamacare anymore. Or you hear about pre-existing conditions. Why is that? Because people who had insurance and who voted over in a job worried that if they had a family member with a chronic illness, or if they got a chronic illness, or if they got too sick to work and they had to go to the individual market, they didn't want to be discriminated against. They didn't want to be denied insurance. There's a wonderful opportunity for Republicans to communicate with people who vote because seniors vote at a higher rate than any other age group. And what did Republicans do for seniors? It gave them Medicare Advantage. Now, in our healthcare system, we have two exchanges, only two. And in these exchanges, buyers choose among competing healthcare plans, and they do it in an open season of about 6 weeks. And there's government subsidies, and the plans compete, and you enroll in a plan, you're there for a year, and then a year later you can choose again. Again, two systems. One Medicare Advantage, the other Obamacare. This created by Democrats, this created by Republicans. This thing created by Republicans is working really well. 40% of all seniors are in a private Medicare plan. The Republicans partially privatized Medicare, and that number just keeps growing year by year. Over here, I've already told you Obamacare is a big mess. So you'd think Republicans would go out and point this out to senior voters. In fact, they almost never do. And then the fourth rule is ignore the special interests. Who gave us Obamacare? It was big pharma, big insurance, big business, big hospitals. They sat around a table and they carved up the market and created Obamacare. And without their help, you never would have had Obamacare. So special interests designed Obamacare, but the ink is barely dry on the bill, And Democratic politicians are out there condemning greedy insurance companies, greedy drug companies. So they don't hesitate to bite the hand that feeds them. Republicans, on the other hand, think, well, if we're nice to the people who give us money, when we're out of power, they'll be nice to us. And what they don't realize was that, there's no honor among thieves, and the special interests aren't any kinder to them than the Democrats are. So I've been trying for probably 2 or 3 decades to convince right-of-center members of Congress, some Democrats, mainly Republicans, that they need to think about health care carefully, that this is a very important issue. And except for 1 or 2 exceptions, I failed. Republican candidates just don't want to think about health care. Now, Democrats don't know any more about health care than Republicans. The difference is that Democrats know how to talk about health care and Republicans don't. So Marie Fishpaw and I got together some months back, and we decided, well, we need an answer to this. If Republicans aren't going to think about health care very carefully, maybe we could have 8 or 10 simple ideas that they could repeat, memorize, and use. And I got the idea from Newt Gingrich, who way back in 1994 had a contract with America, and it fit on 1 page in Reader's Digest, and it said, if you give us control of the House of Representatives, here's what we're going to do. Easy to understand, didn't require a lot of explanation, and they won. For the first time in 40 years, Republicans took over the House. So I sent this idea off to Newt, and he really, really liked it. And the first idea that we have is that we have to put an end to outrageous out-of-pocket spending. And okay, give me just another minute. I'm going to borrow a minute or two here from Marie over here. So Obamacare was designed by people who liked the kind of insurance it created. So the people who wrote the bill, I mean, they have $25,000 in their bank account. So if they had to pay that, they can. But then if they have $1 million premature baby, insurance pays for that. In fact, there's no limit to the catastrophic coverage under Obamacare. But for young, healthy families with very few assets and moderate income, this is never the kind of insurance they want to buy. And for people who worked for fast food restaurants before there was Obamacare, they were often given a choice between a Blue Cross plan with a pretty substantial deductible and a substantial premium, or what I call limited benefit insurance, which means the first $25,000 or $50,000 is covered and nothing beyond that. And 95% of them chose the limited benefit. Why? Because they're concerned that if their child gets sick, they want to know they can take them to the emergency room or take them to the doctor and pay the bill. And if they have $1 million premature baby, well, they don't have $1 million anyway. So the safety net is going to pay for that. So the answer here is let people buy insurance that fits their financial situation and their medical condition. Let them buy what they want to buy, and then use the safety net to cover the things that they don't buy. And then on the narrow networks, we already have the model, and it's Medicare Advantage. And Medicare Advantage plans can specialize. They can specialize in diabetes and cancer care and lung care. And any of you who are of Medicare age, you get this little booklet, you've probably seen it, and the plans are even labeled. Here's the diabetes plan, here's the cancer plan, so forth. And they can ask health questions, and they can exclude you if you don't fit the condition they're designed to treat. Over in Obamacare, health plans cannot specialize. They cannot ask health questions. They cannot receive more money for a sicker patient. In Medicare Advantage is the only place in our whole healthcare system where if a doctor discovers you as a patient have a change in condition, let's say they discover you have cancer, that doctor can send that information back to the insurer, which in this case is Medicare, and the plan gets a higher premium. That doesn't happen anywhere else in the healthcare system. So in Medicare Advantage, the plans compete for people with chronic illness. In Obamacare, they run away from them. So Marie's going to come over here in a minute and tell you a bit more. But our theory is that, well, at least right-of-center candidates ought to learn some lessons about how to talk about health care, and we got to do that before we can really reform health care. Thank you all.
Well, thank you. How much time do I have?
15 minutes.
Oh, great. Thank you. Can you all hear me?
Yes.
Great. Okay. So thank you, John, and thank you for Anne-Marie for inviting me today. It's a real pleasure to be here. Part of the reason that it's so important, the work that John is doing, and the work that we are doing with really dozens of leaders across the country to pull together a way to reform healthcare towards freedom, is that freedom in healthcare is both facing an unprecedented challenge and risk today, and an opportunity that hasn't existed in probably over a generation, if not more than that. So freedom is at risk from the left because their vision of healthcare is to outlaw your private coverage and put you on a government-run plan. If you like your DMV, this is the plan for you. And what's unprecedented about it is that they have the Democrats have gone all in on this in ways we haven't seen before. A majority of Democrats in the House are signed onto this bill. Leftist advocates are pouring money to get members to do this, to support this bill. And we have, for the first time in certainly a very long time, a Secretary of Health and Human Services, the guy who can write every regulation in the direction they want to go, is a full-throated supporter of this socialist idea, as is our Vice President Harris, who was an original co-sponsor of the idea. And if they can't do that right away, the Democrats are taking incremental steps in this direction. They want to put more people on Medicare. They want to add more benefits. They want more people on Obamacare. The list goes on. For the first time, rich people have been granted subsidies to Obamacare. This is an unprecedented move towards a lack of freedom in our healthcare. And this is an incremental strategy playbook they've been running for decades, and it's working. We have about, by some estimates, 80% of all healthcare spending in this country pre-COVID was either directly controlled or influenced by the government. And we know what this has gotten us thanks to the recent example of Obamacare, because it was a moment in time where many things shifted and we could watch it. It wasn't just a lobster in the pot getting boiled. So we saw higher costs, right? Premiums doubled nationally from the time the program was created to today. It's tripling in some states. Your choices fell about 36% as insurers fled the market. And if you were sick, as John has written so well, you probably couldn't see the doctor you want anymore. These are tragic, real-life stories. There was a really heart-rending story in the New York Post recently of a dad whose little girl, a 2-year-old, had gotten leukemia. And the plan they had been on pre-Obamacare would have taken care of her. He couldn't find a plan to cover her. The plan he signed up for, the one plan that covered her, dropped them, and he had to go to his senator to get health care. That is not a system anybody wants, and it is a system that privileges the wealthy. All right, so who is doing well under this system right now? Well, it's insurance companies, as John was talking about. Obamacare gives more money to an insurance company every time they raise their prices. Money from you, money from taxpayers. That's really a great recipe for the kind of higher cost and reduced value we've seen. Okay, so why is there actually reason to hope with this storm cloud over us? Well, it's because for the first time, we've seen the movement of what deregulation can do, what moving towards freedom does. And this is thanks to President Trump, as John was outlining. Things have been going on so long, sometimes it's hard to visualize your alternative possibilities. Because there is so much red tape between us and our doctor and us and the choices we'd like to make. But we saw a lot of what Trump did with regulatory relief start to come to fruition during the pandemic. And I think one of the biggest examples, which John did get into, so I don't want to spend too much time there, was the ability to see your doctor when you want to, where you want to. So this is, telemedicine. How many of you have talked to a doctor in the last year, right? By phone, by video call? How many of you have tried to do that recently? Could you see your doctor that way? They're still seeing you?
My mother.
Your mother does? Your mother's? Yeah, exactly. Exactly. Well, this is what freedom produces. It produces the ability to go around a lot of the waiting lists, the driving to see a doctor that you might not want to do, and to see your doctor when you want to. Now, there's news stories popping up. The ability to see this was something that accelerated under the pandemic because Trump swept away regulations, and so did a lot of states. It made sense, right? There was a lot of fear in the air. People wanted to stay home, see their doctor, and sometimes some states said you can't actually go see your doctor because we're banning a non-emergent care. So doctors had to scramble and set these things up because they wanted their patients to get the care they needed in some form. So we saw usage just jump, because these regulations were out of the way, because demand was up, this thing exploded. And doctors say they want to keep doing it, patients say they want to keep doing it. It's a great option we should be able to keep. But these regulations that were taken off the books are coming back. So there's news stories now about, particularly in some states, doctors won't see you anymore through Zoom or what have you, out of fear that they're out of compliance. There's literally, and that the absurdities we start to see because of regulation are becoming quite clear. So for example, a doctor told their patient that they could see them over Zoom if they drove 3 miles over the state line, took a picture on Google, where they were on Google Maps, and sent them to comply. This doesn't make sense, right? This is not freedom in healthcare. And for the first time, we have this sort of contrast between what could be, but for the government, and where do we want to go next? So there's other things that I think are important to dwell on, but I don't want to spend too much time. So, the good news is that there seems to be not just a conservative libertarian consensus that this kind of freedom in telemedicine is good, but rather a bipartisan one. It's not one of the few places where the reality on the ground is so clear that the path forward is clear as well to politicians. So I want to talk a bit. I don't know if I want to. How much time do I have at this point? 8 minutes. Oh, okay. So there's a list, as John was saying, of other things we could do to make the market work better for you, to let you pick the plans you want, the doctors you want. If you get sick, get the care you need, and get all this at prices that work for you. I think one thing we have to talk about is how is our safety net at play with this? So the Democrats on the left would like to say there's this group of people who are poor and need care, and I think as Americans we've agreed we don't want them dying in the streets. We are compassionate as a nation. How we could ideally get there, John spoke about in the beginning, but where we are now is we have a system that puts our poor and our sick in substandard, ghetto-like government-run plans. I live in Washington, D.C., which is pretty leftist, and when I was in between jobs, because I was thinking about doing a startup, I got put on Medicaid. So in DC's wisdom, I tried to get off, and then I thought, okay, they won't let me get out of this. I still have to buy a private plan, so let me try to compare these two. I couldn't see a single doctor I needed. And if I didn't have, enough savings to justify this, where would I be? I think I would have been very, very sick. So we need a functioning free market, and we also need a functioning safety net. And it needs to begin from the principle that the best and most effective way to deliver the goods to people, we all know this, is through the free market innovation, so we need to get out of their way. And when someone needs extra help, they need to control those dollars and decision making. Not the government, not big insurance, not whatever big special interest you want to put on the table. But if we get these two pieces working right together, we get those wonderful innovations John was talking about. These, if you have diabetes, you have the freedom to go get the plan you need. And if you need extra help, you're going to get it in a way that is empowering people, not big business and not special interests. So I'm going to stop there because I feel a little bit like I'm up against the time window. We have been working with this group of conservatives to advance a proposal like this to fill in the details of the ideas that John put together. It's called the Healthcare Choices Plan. You can see it at Healthcare Choices 2020. And I think we would love to take any questions for you to better understand how we're thinking about it. If you really want to get into more of the details, they are there for you to find. So with that, Anne-Marie, back to you.
One of the problems is a lot of people don't understand how healthcare runs or functions. It's very complex, especially young people. They love their employer insurance, but they don't understand why they can't get a raise at work. Nobody has any idea how much money it costs their employer and themselves out of their own compensation they are spending on their compensation to an insurance company, and many of them are healthy and would never had to spend this money out of pocket and shop for their own insurance, would not buy these plans. And so people don't understand that. One of the greatest innovations to happen not too long ago is something called direct primary care. I was shocked to read recently only 1% of primary care physicians are in a direct primary care practice. How many here are familiar with this model or use it? It's fabulous. I'm in one. I pay $80 a month. My first visit to my doctor was 2 hours. And you walk in there, and it's unlike any doctor's office you'd ever see. It's quiet. You don't see a bunch of people buzzing around in a back room, coding and doing all kinds of administrative work. They get to know you. You know, one of the things that we know that really helps protect people's health is continuity of care, having a physician that you have for a long period of time who gets to know you and helps you address your healthcare issues. What happens now, everything is so fractured. People are moving in and out of one system. They might move to a different employer. They have a new network they've got to deal with. They have a new doctor. And then we have this discontinuity of care, which is a real problem. So maybe I'll start it out. Maybe what we can do is, if you wouldn't mind stepping up to the podium, and asking your questions. We probably want to get as many in as possible, so I would ask you to try to direct your questions to more specific questions instead of personal descriptions of anecdotal kinds of information, so we can cover a lot of ground here. So go ahead, sir.
First, I tend to describe it as medical care and medical care insurance and not health care. You know, people are responsible largely for their own health. But as I understood, Rand Paul was trying to develop some legislation, and I can't remember the details of it, that as I understood, was trying to create group insurance for people to join that was outside of their employer, that they could create other groups and be able to buy insurance. Are you familiar with that, and is there any potential for something like that?
Well, Marie probably knows more about this than I do, but we've made the first step, and that is allowing employers to take pre-tax dollars and put in an account for the employee and let the employee choose his insurer. So that's huge. And then the next step is to amend that law and say that the kind of insurance they can buy does not have to be Obamacare compliant, that it can be insurance that meets their financial needs and medical needs. So that's the direction. I think everybody on the right wants to move in that direction, and the Trump administration made a lot of progress. Do you want to say anything on it?
Well said.
All right.
John, you were mentioning that we have to deal with what we have today and not just totally make it a total free market. We can't get there. But as you were mentioning, 1% is kind of a total free market doctors, and then there's places like the Surgery Center of Oklahoma where you pay cash for surgery, and it's been very successful. Do you see a trend in that way of growing more and more? I didn't know it was 1%. I thought it was more than that. And I wish it was more than that. But do you see a trend that just outside of government health care and just maybe cash and things like that has been very popular?
Well, I do, and that's one of the points in our health contract that we think Republicans and right-of-center candidates, even if they're Democrats, ought to be talking about. Now, the Trump administration did two very important things. It tried to get the IRS to change the regulations so employers can put money into an account and the employee can choose his primary care doctor. The employers now, today, in fact, this is one of the fastest growing trends in the group insurance market, they're contracting with direct primary care doctors, but that's the employer choosing the doctor. Better to put the money into the account and let the employee choose the doctor. If you don't like the doctor, you go to another doctor. Another thing that the Trump administration tried to do is let direct primary care doctors be available to Medicare patients, but as one of the direct primary care doctor associations explained to me, almost everybody that's in this business doesn't want to have anything to do with Medicare. So that's one of the problems. So we need to allow the Medicare patient to go to a doctor that you can talk on the weekend, by phone, by email. You don't have to go to the emergency room. It's really good, but that doctor shouldn't have to be in Medicare. So the last administration really liked this. I don't know about the Biden administration.
Yeah.
Go ahead.
Yeah, the only thing I would add is we don't have a lot of examples of functioning free markets and their ability to affect prices, but we do with direct primary care. They're one of the few models where their monthly subscription fees on average are coming down. You don't even get that out of Netflix, right? They keep going up. So I think this is a remarkable testament to the kinds people are happier when they get to work with their doctor this way, and they're starting to save money.
Thanks. Steve Everest with Everest Health at covid-age.com. See, I don't think we're talking about health care. I think we're talking about sick care here. I think we're dealing with the margins of the issue. I think the central problem we have is 80% of all health care costs are due to poor diet and lifestyle. And until we have to pay for the privilege of mistreating our own bodies, I don't think we have a health care system. We don't have a value-based care system. So can we talk a little bit, yeah, thanks. How do we start developing that system, value-based payments? How do we make that transition to address the real issue here? Thanks.
Well, the Obamacare folks allowed a small discount if you engage in healthy behavior. Now, too small. Now, subsidy is the converse of a penalty. So if you can give a discount to people engaged in healthy behavior, that means that people who aren't are paying a penalty. But it's not nearly enough, and you're absolutely right. People are not paying the cost of their bad behavior, and see, one of the ideas that I really like is expanding the idea of a health savings account and letting the patient manage his own care. So, for example, if you were diabetic and your employer might say to you, "Well, look, you're costing us $3,000 a year. If you're willing to manage your own dollars, we'll put an account for you. And if you comply with your medication regime, you stay away from the emergency room, you save money, you get to keep the money."
I'll go ketogenic with those dollars. Health savings account dollars help me buy healthy food options. Food is pharmacy.
There you go.
Those are solutions I'd like to see more of.
Fair enough. Okay.
Yeah. All right, thanks for that. Any other thoughts on how we make this transition to value-based care? Because there is the real problem, isn't it? Wouldn't we agree?
Yes.
Yeah.
John spoke it all here.
Yeah, and I would like to add, people are so individual. What matters to one person doesn't matter to another. Maybe you do need weekly massages to feel better and feel good about your health. And maybe you don't need all the prescription coverage. I don't know. Everybody is so individual. And when you have a top-down approach, it doesn't work. I mean, my goodness, our whole experience with the pandemic is exhibit number one why top-down approaches do not work. The most vulnerable people that we knew were elderly people. And we did a horrible job protecting them. Instead, we went after everybody else. And, imagine if the government didn't do anything, how we could have figured this out on our own. That's the beauty of the free market.
Well said.
First, I want to thank you for your work in this area, particularly health savings account. I've enjoyed my health savings account since it was called a medical savings account. Until now, once I turned 65, I could no longer contribute to my health savings account. Why is that, and can something be done about that?
Yes, in fact, we're advocating that something done. That's one of the planks in our 8 to 10 reforms. Why it is because one of the reasons why a health savings account is such a good way to save. It's better than an IRA, better than a 401k, because when you get to be 65, you can use the money in your account to pay Medicare premiums. You can't do that with an IRA or 401k. But at that point, they didn't want you to get a deduction to put the money in the account to pay the premium, because that would be just like allowing people to deduct their Medicare premium. So that's technically why it happened. What ought to be done is the seniors ought to have what I call a Roth health savings account. So a new kind of health savings account, you can put money into it. Your insurer can put money into it at no penalty for you, and then the money comes out tax-free. So there's a solution to the problem, and you're absolutely right. We're right now discriminating against seniors, and we shouldn't be doing it.
You said why is that? I think, John, you sort of undersold some of your impact earlier. Getting health savings accounts to be a reality at all was a really big deal. And it's, I think, given us a platform to see what reform possibility could look like. So part of getting it in there was some trade-offs were made. And also, who knew that people were going to use their HSA and 20-some years later start to want to use it in Medicare at the time. So I think the reason it's important to take these examples of success, use them to call forward, hear voices like yours, is that's how change is going to continue to occur. And we reset the baseline every single time to inject more freedom as we find the problems as they emerge.
I echo what he said. We loved our HSA when we were in corporate America. Now we're in Medicare. We like Medicare Advantage too. I have read about a pilot Medicare HSA program. It was a pilot a couple of years ago, and I was hoping that it would succeed. It had to succeed, right? And that it would expand. And every year I look in Colorado and I do not see the Medicare HSA. The way it worked was Medicare would put some of the money into the HSA and then they would leave me alone. I want to be left alone. I don't want them to know what I do. I don't want them to tell me what I do. So you know anything about what's going on there or what could hopefully?
Just a tiny bit. There's something called a Medicare Msa. It's a Medicare Advantage MSA, medical savings account instead of a health savings account. And it works about like how you described it, but no one has to offer it, and I only know one person who has one. We need to free the market for seniors. I mean, to me, that's obvious. And if I were a politician, I were running for office, and I know elderly people vote more than younger people, I would make a big deal of this. And then some seniors continue to work and get insurance from an employer, but they can't contribute even though Medicare is not their primary payer. So we need to change that too. So Maria and I have been working with other think tank people and working through the details on what kind of reform we really need. But then when the dust is settled, we need to be able to explain it in very simple terms. And the simple one sentence is seniors should have a health savings account.
Thanks, guys, for the presentation. My question is, like, what is a healthy human being worth, right? So if I get my arm cut off, it might cost, I don't know, $200,000 to fix it. Well, that must mean I'm worth, I don't know, $5-10 million. So, like, my vision is that we reimagine what a healthy human being is worth. Maybe you get $5,000 a month in wellness benefits or some new wellness coin. And because right now we're spending about $1,000 a month per person, no matter who you are, what state of health you're in, $13,000 a year. So why not disrupt the whole system, reimagine the paradigm? Because we're operating under a completely outdated, dysfunctional, corrupt paradigm. There's no competition in healthcare. I'm being forced to pay for something and getting limited options. It's ridiculous. So the whole thing is falling apart. So my question is, reimagine the value of a healthy human being.
And I agree with you. And getting there in small steps, creating wedges, empowering people, liberating the market. We see how well. Medicare Advantage is an example of a wedge that in the beginning, Obamacare, when he ran for office, attacked that whole program. Now the Democrats don't like it, but they're not attacking it. It's not nearly where it could be. So some of the things that some of you have already mentioned, those could be done in a liberalized Medicare Advantage. There's still way too many regulations there. So now that we see it working so well, I think we can make the argument, well, let's have more liberation, more freedom, more patient power.
Yeah.
Just don't let Ezekiel Emanuel determine the value of a healthy person.
That's right. Because it zeroes out at 75, doesn't it?
Yeah. Zeros when you're born and zeros out when you're 75.
Yeah, and to your point about transforming things, the people who are competing and who are innovating, so the people who created telemedicine so that it was ready when the pandemic came, the direct primary care doctors, they are doing it with their hands tied behind their back and a headwind in their face. And you give them just a little bit of regulatory relief and look how it flows. So these are the kinds of, when we talk about step-by-step movements, we have to be finding those clear points where you remove the headwind, you untie half a handcuff, and watch things go. And that is what I think the promise of the work that John and I are doing really can bring to this country. So thank you all for listening to us.
Yes. Thank you all for coming. Don't forget to take a goodie bag. There is a copy of the book. And then if you stop by again in our booth, John's going to be doing some book signing. You can ask him more questions. We'd love to see you. Thank you again for coming.